Hi, I'm here with Caitlin Lander. She is a former patient of Dr. Deepak Sudheendra's, and she is going to share her story today about how she came to find interventional radiology. Caitlin, walk us through your journey with this. Tell us a little bit about your initial diagnosis and then how you came to interventional radiology for your treatment.
Sure. I was a junior in nursing school and developed a blood clot. I was very active, was in theater, and I thought I had pulled a muscle during a performance of Midsummer Night's Dream, and called my mom and thought, what should I do? My leg's getting swollen. And then it started changing colors. It changed, to red, to brown. So she suggested that I go to the emergency room, and they diagnosed me with a deep vein thrombosis at that time through ultrasound. The ultrasound showed that I might have a problem further up in the bloodstream than just in my leg. So they went on to do a venogram procedure from the groin and tried to open it up at that time. Fast forward, I've had 2 children. Each time I had pregnancies with being on injectable blood thinners called Lovenox, got more complicated. I developed more symptoms. And the physician that I worked with knew his limitations, and when he was unsuccessful in opening up the vessel himself, he told me that it was okay to seek a second opinion. I was pretty defeated that we couldn't get the vessel opened, so I reached out to some fellow Maytherners, survivors, and met up with Dr. Sudhi. He wasn't just seeking patients over social media. He was seeking to improve people's quality of life, and it truly is quality of life. I was able to be stented in March of this year after 13 years of living with chronic pain and swelling in my legs.
Dr. Sudhi, can you talk a little bit about the treatment you used with Caitlin that was different from the treatments she was seeking before?
Interventional radiology, or what we commonly refer to as IR, really has pioneered a lot of minimally invasive treatments. Most of the public is aware of angioplasty, which was pioneered by interventional radiology. And so using a lot of these techniques and innovations, we are able to open the blocked veins from the ankle literally all the way up to the heart. And these are veins which are, as Caitlin mentioned, should be anywhere between the size of a dime, let's say in a calf vein, up to the size of a quarter in the leg. And after having a blood clot, these veins shrink and they actually scar down to the size of almost like a coffee stir. And so we are using little wires and catheters and balloons to break up the scar tissue in these veins and get the vein open almost to its original size so that the leg can drain again.
Can you talk a little bit about venous disease? From what I understand, it affects a large portion of the population, but few really seek treatment for it. Why is that?
Well, Rachel, I think it's important for people to understand what really vein disease is. And there are 2 types of blood vessels that we have, the arteries and the veins. And the arteries carry the blood from our heart to our arms and legs and to our different organs, and it carries blood that is rich with oxygen. And the veins drain our organs, and they drain our arms and legs. And many people are familiar with diseases of the arteries. Peripheral vascular disease is generally thought of as being arterial disease. Venous disease is a little different. And venous disease consists of diseases of the superficial veins, which is what we refer to as chronic venous insufficiency, and the deep veins, where people get blood clots, or what are known as deep vein thrombosis.
Do you see more patients seeking interventional radiology as a treatment these days when it comes to venous disease?
Interventional radiology is not yet a household name, and I hope it will be, but unlike a dermatologist or an ophthalmologist, the patient may not have heard of an interventional radiologist. So that can be a little difficult in trying to get the patient through the door.
Dr. Sudhi, is there anything you would like the medical community to know about the use of interventional radiology when it comes to treating venous disease?
So one thing that physicians can do is to reach out to their interventional radiologist and ask them about some of these procedures. Even if these procedures may not be done locally in a hospital, in a community hospital, there are centers where maybe patients can be referred if an interventional radiologist is not doing it in the community.